Okay, so thank you, everyone. Thank you, the Pediatric Society, for always inviting me to be a part of your convention, even during this time. So today, I'm going to talk about skincare for teens. Don't worry, my presentation is short. I'm hoping that I'll be able to do this, and then we'll have time for the question and answer. So my disclosure, I have no conflict of interest. I am affiliated though with a lot of companies, but the most of the products that I would mention here are actually based on the book by Bologna. So just to remove bias. So please don't record me or quote me. This is just to simplify things. I am not endorsing one product over another. Okay, so basically the learning objectives today is to identify the basic skincare regimen we can advise to teenagers, to simplify the choices because there's a lot of skin products out there, and to give a rationale for each skincare product. And since my Dr. Tet and Dr. Matias actually described a lot of the diseases already, I'm just going to give a very, very brief description of diseases encountered by teenagers that necessitates a basic skincare regimen. So let's go right through the skincare products. We can actually divide them into 3 basic categories. No? So we have your cleansers, which are designed to remove sebum, thus combating corneocytes, bacteria, fungi, environmental dirt from the face and the body, while leaving the intercellular lipid barrier intact. So Dr. Tet actually delved through a lot about the skin microbiome. So basically what we want is to remove the pathologic bacteria, but do not destroy the skin. So that's what the cleanser should be doing. Astringents, on the other hand, are actually subset of your cleansers designed to supplement the failure of the cleanser to perform its intended function. So moisturizers, on the other hand, is designed to minimize the barrier damage induced by the cleansing. So in basic, okay, so first case, so we will discuss all the skincare products by discussing a case. So for our first case, we have a healthy 13-year-old female is seen for a 3-year history of a rash that appeared on her arms, then spread to the chest and back. A few similar rash appeared on the side of her face and legs. So past medical history includes bronchial asthma, the last attack at age 4, atopic dermatitis with the last exacerbation at age 10. So currently under medications for allergic rhinitis. So this sounds familiar. This is basically a case of your atopic triad. So mother asks you what soap she should use. So let's give them 5 seconds. 5, 4, 3, 2, 1. So should you prescribe a mild soap for this case? Or antibacterial soap or a sulfur soap? So mostly most of you got it correct, no? You will prescribe a mild soap. Although a few advised a sulfur soap. Okay, now what is this case? So if you look closely at this case, you will see, hold on, there. So this is a case of keratosis pilaris, and it's correct, you use a mild soap for this one. So KP, or your chicken skin, is a discrete perifollicular papules with central keratotic cores on the extensor surface of the upper arm. So each papule has a rim of hyperpigmentation. So the question here is that, is this atopic dermatitis? So Dr. Tet described the criteria for your atopic dermatitis, and she also explained that some cases of AD actually improve once they reach puberty. But there are certain cases that they do not resolve. So we can only say that this patient has atopic dermatitis if it will fulfill 3 of the 4 major criteria. For the KP, if you look at it, it's a minor criteria. So some patients, when they get older, they don't have any more of the major features, but some of the minor features they would have. So you will not diagnose this patient as atopic dermatitis, but you will just diagnose it as a simple case of keratosis pilaris. So in basic clinical terms, soap is a fatty acid salt resulting from a reaction between a fat and an alkali. The soap solubilizes sebum and environmental dirt such that it can be rinsed away with water. The mechanics of rubbing the soap over the skin with the hand results in the physical removal of scale, bacteria, and fungi from the skin surface. In our country, bathing has become a daily ritual. Excessive use of soap has resulted in some conditions like cirrhosis or even eczemas. This has led to the development of cleansers with skin conditioning benefits that are chemically not true soaps. And they are referred to as detergents because if you say soap, it should be like fat. Okay, but now there are new cleansers that are either formulated as bars or liquids, and they can be divided into three basic types. So you have your soaps, synthets, and comb bars. Again, true soaps are composed of long-chain fatty acid alkali salts with a pH between 9 and 10. This alkaline pH raises the pH of the skin following cleansing, resulting in stratum corneum barrier disruption and the resultant feeling of tightness following bathing. Alkalinization of the skin disrupts the natural acid mantle, which may be significant in the dermatitic skin. Recognition of the need to preserve the skin at pH 5.4 led to the development of what we call synthetic detergents known as synthets, such as their sodium cocyls isethionate. I'm not going to mention the brand. It's already written on the slide, so you can just look through that. So these are synthetic cleansers, also known as beauty cleansers. They contain less than 10% soap and are designed with a pH of 5.5 to 7.0 in order to minimize cutaneous alkalinization. The third type of cleanser, known as combar, is composed of an alkaline soap to which surface active agents with a pH of 9 to 10 have been added. Combars are mild cleansers than true soaps, but induce more thorough cleansing than synthets. So for example, true soap is a good cleansing agent for excessively oily or dirty skin. So if you have a miner, you have a farmer, then you can actually give a true soap. Combar naman is a good cleanser for normal skin with a moderate amount of environmental dirt. So just a teenager inside the house, then you can just give a combar. Now, if you have a patient with any dermatitis, then you can give your synthets. So back to our case, what mild soap? How do you define mild soap? Will you give like a body wash, like a synthetic detergent, like a lipid-free cleanser, cold cream cleansers, exfoliant cleansers? Medyo marami pa rin yung definition ng mild soap. And even wala pa tayo sa brands niyan. So these are just categories that we just have to go through. And hopefully, you'll be able to figure out which one to give. Another important dermatologic need with regard to skin cleansing is minimization of skin barrier dysfunction. Unfortunately, surfactants cannot distinguish between unwanted sebum and oil-soluble dirt and the intercellular lipids. Thus, increases in transepidermal water loss are typically noted in direct proportion to the cleansing ability of the cleanser. So an attempt to provide cleansing and barrier restoration in the same product has led to the development of what we call body washes. So since body washes are liquids incorporating both hydrophilic and lipophilic ingredients emulsified into a single phase, it is possible to cleanse and moisturize simultaneously while allowing for rinsing away of the surfactants. The synthetic detergent, primarily your ammonium laureth sulfate, solubilizes oil-soluble dirt into the rinse water for removal during the cleansing phase when the body wash concentration is high and the water concentration is low, while occlusive moisturizing substances like your petrolatum and your emollients like your soybean oil are left behind to retard transepidermal water loss and improve skin smoothness during the rinse phase when the body wash concentration is low and the water concentration is high. Other cleanser variants for persons with dry dermatitic skin include lipid-free, non-foaming cleansers, and we have what we call cold creams. These products are excellent at removing cosmetics and low levels of environmental dirt. Lipid-free cleansers are non-foaming, soap-free liquid products applied to dry or moistened skin, rubbed to produce minimal lather, and rinsed or wiped away. They possess low surfactant capabilities and they can only remove bacteria through mechanical means. Yet they are important in persons with barrier disruption. The classic cleanser for dry dermatitic skin is actually a cold cream, which combines the effect of lipid solvent such as wax or mineral oil with detergent action from borax. However, for our particular case, we want to induce corneocyte disadhesion because this patient has a very thick keratotic skin plug on the skin. So basically, you want the part of the skin to go away. I mean, you want to remove this. So this is where we are actually prescribing an exfoliating cleanser. So we have that. So basically, in specialty cleansers, this is where specialty cleansers would come in. So to help remove the keratotic plug, so skin is smoother, and of course, most Filipinos would would really love a lighter skin. This can be accomplished through the addition of chemical exfoliants such as your salicylic acid or glycolic acid to the cleanser formulations. So all of these novel detergents and cleansing specialty additives has created a confusing plethora of consumer products. Yet whatever it is that you're going to give your patient, you just have to have the same goal: to allow adequate skin hygiene without destroying the skin. Okay. So for this skin, for our case, what else to give? Now you've understand what mild soap is. Then next is, what else can you give this patient? So moisturizers. So moisturizers, you really have to give a moisturizer for any patient with dermatitis, whether they're allergic contact or atopic dermatitis, or they just have plain KP or dry skin. However, the term moisturizer is somewhat misleading to the consumer, who assumes that the cream or lotion, and even to the doctor, who assumes that the cream or lotion actually puts moisture or water back into the skin. Moisturizers do not put water back into the skin externally, nor do they get incorporated into the intracellular lipids. Moisturizers simply attempt to retard transepidermal water loss and create an optimal environment for restoration of the stratum corneum barrier. The optimal water content for the stratum corneum is between 10% and 30%, depending on the measurement technique employed, and the moisturizers can function to raise the cutaneous water content through occlusion or humectancy with a variety of active agents. So we say occlusive moisturizers prevent evaporative water loss to the environment by placing an oily substance on the skin through which the water cannot penetrate, thus replenishing the stratum corneum moisture by water movement from the lower viable epidermal and dermal layers. And there are many different classes of chemicals that can function as occlusive moisturizers. So you know some of these. The basic would be your petrolatum, your oils and waxes, your hydrocarbons, your silicone, vegetable oils, corn oil, grape oil, soybean oil, just choose your oil. Fatty acids, no, there's a lot of them in the market right now, and they can actually include your sterols, your ceramides, and your cholesterol. The most effective occlusive moisturizer, though, is petrolatum, since it reduces transepidermal loss by almost 99%. Total occlusion of the stratum corneum is undesirable. You don't want to really occlude it, no? Since transepidermal water loss is the cellular signal that initiates barrier repair and the resulting synthesis of intercellular lipids. Complete cessation of your transepidermal water loss results in no barrier repair, allowing water loss to return to its normal pre-treatment level once the complete occlusion has been removed. Petrolatum allows barrier repair while permeating throughout the interstices of the stratum corneum. So another technique for rehydrating the stratum corneum is the use of humectants. Humectants, on the other hand, are substances that attract moisture. They include your glycerine, your honey, sodium lactate, urea, and all the other stuff. And the one mentioned here is hyaluronic acid. So the body utilizes hyaluronic acid and other aminoglycans in the dermis as biologic humectants to prevent desiccation of the skin. Humectants can hydrate the skin from the environment only when the ambient humidity exceeds 70%. So in a tropical weather like us, then maybe we can achieve this. But if you live in the desert, no, I don't think that you can achieve that. Consequently, rehydration of the stratum corneum generally occurs by water that is attracted from the deeper epidermal and dermal tissues. Most moisturizers combine both occlusive and humectant moisturizing ingredients. Since water by a humectant to a damaged stratum corneum barrier will be lost to the atmosphere unless trapped by an occlusive. Humectants also help to improve the smoothness of the xerotic skin by inducing corneocyte swelling and minimizing voids between the desquamating corneocytes. So now, I hope that's basic for that particular patient. You need to give a mild soap, and right after that, put a moisturizer. So for this second case, this is a case of a 10-year-old male with smelly armpits. Mother claims boy bathes every day after school. So this is what he does after school, goes to the farm. And this is a boy actually collecting betta fish to sell. So what will you give this a boy? Will you give it a mild soap, an antibacterial soap, a sulfur soap, or a whitening soap? 5, 4, 3, 2, 1. Let us see the answer. Okay, almost all of you got it, no? So you need to give an antibacterial soap. So for this particular case, ayaw niya mag-move. Why? There. So for this particular case, this is a case of bromhidrosis. So we know that as a child turns into puberty, hormonal changes happen. And of course, they also grow hair. And when they grow hair, comes with it are the apocrine glands and your sebaceous glands. And when you have all the secretions coming out from their body, bacteria and yeast can actually infect them. And so you have an abnormal body odor. So the many brands of cleansers currently on the market fall into the three aforementioned groups that I actually explained earlier, but there must be something unique for marketing purposes about each cleanser. Now, common cleanser additives include fragrances and foaming agents designed to alter the aesthetics of the latter. But the most dermatologically relevant additives are your antibacterial agents. So the most widely used antibacterial in both bar and liquid cleansers is triclosan. So triclosan works by blocking lipid synthesis in the bacterial cell wall, thus decreasing the skin biofilm bacteria count, and of course, in a way, it would reduce body odor. So next case, we have a 16-year-old female came to ask for a cleanser for her problematic skin. She has been buying online products to no avail. Mother thinks she is too young for cosmetics. So for this case, what will you advise? So is it mild soap, sulfur soap, benzoyl peroxide soap, or a whitening soap? 5, 4, 3, 2, 1. Let us see the answer. Okay, yay. So a lot of you answered benzoyl peroxide soap, but still a few will advise a mild soap, no? And a sulfur soap as well. But yes, this is a case of your acne vulgaris. So we would advise the use of your benzoyl peroxide. So we know that in patients with acne vulgaris, the pathogenesis of which would be, again, the development of the hair, comes with the sebaceous glands. And the sebaceous glands is actually infected by your, used to be called a bacteria, used to be called Propionibacterium acne, but actually now they're changing the name to Cutibacterium acne. So basically for your acne, you need to do two things, no? Number one, you need to remove the oil because that's what the bacteria, that's what the bacteria eats. And actually that's where the plaguing happens. And an antibiotic, so it can be in the form of a wash. So in simplest terms, usually that's what you need to do, but of course it's more, acne vulgaris is more complicated than that. So for other things that you can do for this particular patient is an astringent. You have to give an astringent. So occasionally patients use skincare products that correct the deficiencies of the cleanser or supplement the effects of the moisturizers. So these products are known as astringents or toners, and they're used after cleansing, but before you moisturize. So, and they are left on the face following use. Astringents are usually lipids wiped over the face with a cotton ball. Originally, astringents were intended to remove the soap scum left behind on the face from the use of lye-based soaps and hard water. If left behind, this soap scum could cause irritant contact dermatitis. The original astringents were fragranced isopropyl alcohol, parang alcohol lang talaga na mabango, or propylene glycol solutions designed to remove oil-soluble residue. However, the development of synthetic detergents and treated water has made this original intent obsolete. So, but yes, yet astringents remain popular. Currently, astringents are used to remove the oily residue left behind after cleansing of the face with your lipid-free cleansers or your cleansing creams. Oily complexion astringents are formulated to remove any remaining sebum from the face following synthetic detergent cleansing or to deliver keratolytics such as salicylic acid, glycolic acid, or witch hazel, no? Which are treatment actually for your acne vulgaris. Some astringents, though, are designed for dry skin, and they contain a humectant liquid moisturizer such as propylene glycol or glycerin, and skin-soothing agents as allantoin, guanidine, or quaternium 19. So, basically, a complete cosmetic counter facial treatment routine involves a cleanser, followed by an astringent, and then a moisturizer. And then later, yan na yung, once the skin has been prepped, then you can actually add your cosmetics after that. So keep it simple. Last case is a 15-year-old female presented with itchy and flaky scalp. Mother thinks that daughter is too young for a strong shampoo. So what will you advise? Okay, so I hope that you can see on the slide the flakiness, the white thing on the scalp. So would you stay with the baby shampoo, anti-dandruff shampoo, ketoconazole shampoo, or both B and C? Confusing yung choices ko, no? So let us see the result of the poll. Okay, so again, most of you got it correct. So anti-dandruff shampoo, why did I, separate the anti-dandruff shampoo and the ketoconazole shampoo? So the anti-dandruff shampoo, what I meant there is the regular anti-dandruff shampoo that you can buy over the counter. So that would be your Clear, Head and Shoulder, to name the brand. Ketoconazole shampoo is, of course, a medicated shampoo. Okay, so this case is a case of dandruff. So basically, if it's really mild like this, then a regular anti-dandruff shampoo would suffice. However, if it is their seborrheic dermatitis, which is the complicated form of the dandruff, then we might need to give a little stronger shampoo, because that's how we define, in our point of view as doctors, that's what we define as strong. No, but for some parents, giving an anti-dandruff shampoo like Clear or Head and Shoulder is the strong shampoo. So, but in the case of your dandruff, again, when puberty happens, the hair grows, and so comes again the apocrine, the sebaceous gland, and then the oiliness. So, and so if that happens, there's the yeast that tends to overgrowth, and so you control this by using your anti-dandruff shampoo. So shampoos can be likened to skin cleansers, while conditioners are similar to skin moisturizers. So shampoos are designed to cleanse the hair however, this is a complicated task for the female, because for an average woman, there's 4 to 8 meters square hair surface area to clean. Now, shampoos are intended to remove sebum, sweat components, desquamated stratum corneum, styling products, and environmental dirt from the hair and the scalp. So they contain detergents, foaming agents, conditioners, thickeners, opacifiers, softeners, sequestering agents, fragrances, preservatives, and specialty additives. Now, synthetic detergents remove sebum and dirt. However, excessive removal of sebum leaves the hair dull, susceptible to static electricity, and difficulty to comb, creating the need for hair conditioners. Now, shampoo detergents can be chemically classified as anionics, cationics, non-ionics, amphoterics, and natural surfactants. The basic difference between bar soap and shampoo, usually kasi there are patients that would say, no, I just use bar soap in my hair as well, the same as the body. So, pwede ba yun? Technically, pwede naman yun eh. The difference lang talaga is the addition of a higher formation of other salts or insoluble soaps, just to avoid what we call the soap scum. Kasi usually, if you use a bar soap on the hair, it would be very difficult to rinse all the scum. That's why in a shampoo, more of the detergent is added so that you can actually remove it just by rinsing. Okay. However, because without the sequestering agents, no shampoos would leave the hair dull and contribute to scalp pruritus. So some patients would actually complain of scalp itchiness with the bar soap more than the shampoo. So there are many different types of shampoo designed to meet various cleansing agents. So such as this one. So for example, for our case, we since we need to treat the dandruff and seborrheic dermatitis, then we need to give an anti-dandruff shampoo. Okay, so the need for hair conditioners arises from the inability of the shampoo to remove just enough sebum to leave the hair clean without removing too much sebum and creating dry, unmanageable dull hair. So conditioners are also required because permanent waving, permanent coloring, and other chemical hair treatments damage the cuticle, making the hair harsh, brittle, and difficult to disentangle. So hair conditioners are designed to reverse this hair damage by improving sheen, decreasing brittleness, decreasing porosity, increasing strength, and repairing the hair protein. So to end, basic skincare for teens, keep it simple. For the face, use a cleanser. Use astringents only if really oily, especially for patients who have acne vulgaris, and then moisturize. Body, antibacterial soap, and moisturize again. For the hair, anti-dandruff shampoo would normally suffice. However, conditioners are added if the hair turns brittle. Thank you for your kind attention.